Hi, my name is Ashlyn Holcomb, and today I'm going to be discussing the necessities for psychiatric nursing. Psychiatric nursing is one of the hardest areas of nursing out there. Getting prepared for the expertise of becoming a psychiatric nurse can take a lot out of someone who is not prepared for the task at hand. I always believe sometimes it takes crazy to deal with crazy. Psychiatry, the branch of medicine that deals with the diagnosis, treatment, and prevention of mental and emotional disorders. Nursing is a profession focused on the care of individuals. Put psychiatric and nursing together and you get psychiatric nurse, which means to treat patients diagnosed with conditions like schizophrenia, bipolar disorder, and depression. Psychiatric nurses are also trained in the behavioral therapy and care for people with mental illnesses or mental disorders. Not just anyone can be a psychiatric nurse, let alone a successful one. And the discovery of the steps taken that are necessary to become a psychiatric nurse took experience in the ability to deal with patients that are irrational and unstable. Most psychiatry patients are mentally unstable. There's a tendency to find a chemical imbalance in the brain. Psychiatric patients can range from suicidal patients to murderers. According to Psych Mental Health Chapter, when one experiences symptoms that are unremitting and insidious of clinical depression, one can develop a sense of hopelessness. Immediate Medicine Health reports that approximately 19 million Americans suffer from clinical depression and that depression contributes to the half of all deaths. Please keep in mind that depression does not discriminate. It impacts men and women, all races, the young and the old. It should be noted, however, that depression is twice as common among women and about 4 times more likely among the elderly than the young. Psychiatric issues and disorders do not only happen to certain people, it can burden anyone who allows it to attack the mind and body. Depression is considered a mental disorder. Some psychiatric patients may have started out with depression. Depression is considered a mental disorder. Some psych patients may have started with depression and have gone untreated and progressed into a more serious mental disorder or disorders. Education can only take you so far. It must be and know how to provide quality services to a patient in need of care, especially during psychiatric emergencies. It takes a strong person to be a psychiatric nurse. You must have patience, determination, and strength. Psychiatric nurses have to be patient. Working with mentally unstable individuals can be extremely frustrating. If an individual has a serious mental illness or a mental disorder, the patients will not only be healed or fully fixed in a short time. For example, imagine you're teaching a grown adult how to cook a home-cooked meal. But you have to take major precautions because this grown adult cannot be trusted with anything that may be a possible weapon or become a danger to you or themselves. You constantly have to keep an eye on them because they might be a possible danger to you or themselves and unaware of right from wrong. It can become frustrating if they have no desire to cook, but more interested in things that they are not allowed to have or touch. Working with some psych patients is like working with a child that is throwing a temper tantrum. Frustrating, and sometimes the situation is going nowhere. Patience is about being calm and being able to maintain your cool at all times. Patience is about knowing the patient cannot always be fixed or changed instantly, but there's a slight possibility they can be healed over time. Nurses working in the psychiatric department must be determined there is a way to help the patient mentally and physically. Being determined is the ability to want something and not give up because things get hard or seem out of reach. Nurses are the future of healthcare. If they don't want to make a difference, healthcare cannot move forward. In one article, a retired nurse discussed, "I'm concerned by the negativism that faces our new nurses today. It perpetuated by people like Get Real author Laura Venfolio, who seems so angry at everyone. Nurses are the only one who can move healthcare forward, and we cannot do it if we are angry." Nurses must speak up for themselves in a professional manner. Nursing instructors and mentors do not tell new nurses that it is okay to defend themselves. Even in the great place where I have worked for 40 years, nurses still feel that if they talk back to a doctor, they will get fired. I've had a long and wonderful career. Yes, I've been shoved around by plenty of people, but also I've learned early that I have to stand up and be counted. Nursing can be a demanding job, but as well it is rewarding. If you continue to have the mindset to make a difference, there are chances that the range of psychiatric patients did not involve a wide spectrum of all ages. However, children with psychiatric emergencies are coming to the emergency departments in rapidly increasing numbers. Other schools have increased transition programs which allow the student to transfer from one work setting to another. Role transition can be a difficult process, and those who have realistic expectations may experience less stress during the work transition. Any healthcare profession or career that deals with the health of others need to believe they can transition from one setting to another. For example, police officers, firefighters, and any career dealing with the well-being of others need to be determined to make a difference in the community to help others maintain a healthy and fulfilled lifestyle. Determination is the quality of being purpose-driven. Strong nurses are patient, determined to make a difference, and maintain the strength to carry on every day. Nurses have to be physically and mentally fit. Where they have to hold down a patient, they also have to be able to cope with what comes along with the task at hand. If you are mentally not there during a shift, you are more than likely to put you and your coworkers at harm's way. In an article discussed, U.S. National Library of Medicine, National Institute of Health explains, to survive as a specialty, psychiatric nursing must include physical as well as psychological assessments. Psychiatric nurses must reintegrate a medical knowledge base while maintaining a balance with the psychodynamic aspects of care. Nurses must believe they are capable of balancing to prevent overload or emotional breakdown from being overwhelmed. During my interview, I interviewed Nurse Christine. She explained what she found to be heart-wrenching is that psych patients can start as early as 10 years old. According to RN, children may not use the words you expect regarding suicide, so you must probe further. Children may attempt suicide, but those children may not understand what suicide is and the type of harm it may cause. If a child has harmed themselves, Campbell recommends asking, "What did you expect to happen?" or "What did you want to feel?" Responses vary widely from, "I wanted my boyfriend to be sorry and make up with me," to, "I wanted to die." As a nurse and a decent person, our goal should be to ensure make priority that children receive some type of follow-up care. Another author reports, by Daniel Allen, it does not make cheerful reading. More than half of nurses on mental health wards say they are been physically assaulted at work, rising to almost 3/4 for those working with patients who have organic disorders such as dementia. Fractures, dislocations, and black eyes were among the more serious injuries reported. One nurse said, "I was punched in the head." The others sustained injuries including a broken nose and severe bruising. All the members of staff involved were off sick from between 1 week and 3 months, as well as suffering physical assault. It is clear that many staff work habitually in the environments heavy with risk. Of those employed on wards, working age adults, 72% said they had been threatened or made to feel unsafe. Nurses must have psychological and physical strength to deal with the abuse and injuries they may sustain. In an article, "Psych nurses face danger too," one nurse had to say, "However, as a psychiatric nurse, I feel that you are ignored our perspective, including our increased risk of verbal and physical assault, psychiatric disorders, social isolation, a history of violence, and the influence of alcohol or drugs were all named as risk factors for aggression. In the future, please recognize that psychiatric nurses face as much danger and abuse as emergency department nurses when they interact with patients. It requires a special kind of person to put up with consistent kinds of danger, as well as psychological issues dealing with the constant feeling of being in the way of danger. Researchers discovered in Australia Journal of Advanced Nursing there is evidence that nurses working in general healthcare setting have difficulty in meeting the needs of this group of patients. A number of studies found that general nurses perceive themselves as lacking knowledge, skills, confidence in the assessment and management of healthcare professionals. It takes a whole lot of qualities to not only be a psychiatric nurse, but it takes a lot to be a successful one. After all my research, I discovered the career of nursing is not for anyone and everyone. Psychiatric nursing requires a small variety of people that can balance multiple types of patients, control their emotions, are emotionally and physically strong. The patients are aware and take time, determine they can make a difference, capable of coping with what is asked of them, and most importantly, are good with working with patients. As discussed earlier, general nurses found that they lack the knowledge and skills to work in the psychiatric department. During my interview with Nurse Christine, she explained to me the necessities to being a psych nurse is to be physically and mentally strong, emotionally controlled, having patience with the patient, strong-willed, believe you are making a difference, and not everyone can be healed. Being able to deal with patients and provide great patient care is a specific skill in itself. Any career dealing with patient care, there being well-acquired skill. Being a strong nurse is to be patient, determined, and be physically and mentally capable of the task given. Not everyone is cut out for psychiatric nursing. As far back as I could remember, I've wanted to be a psychiatric nurse. And I've had the strong desire to help others and possibly be involved in life-changing events. I chose psychiatric nursing because I thought I might choose the area of nursing for my career. We all have one crazy family member, some even two, that begin to wonder what is possibly running through their brain and why they are the way they are. My goal is to find a way to help the progress and help them. I learned that psychiatry nursing takes a lot of acquired skills that are not cut out for everyone. After research my topic, it surprised me to find the amount of physical and emotional abuse that psych nurses deal with. One nurse described being kicked in the head and another getting a black eye. I did find that I learned a lot from this assignment, but I also was a little educated about nursing because I've had the urge to want to pursue my nursing career for a while. One thing I found I did not know before was that almost 50% of people suffering from depression end in suicide. Thank you.